Did you know that you could get sun cream on the NHS? Or gluten-free pasta? Or gluten-free bread? What's the other things? Travel vaccines? Omega-3 supplements? Millions and millions of pounds will be saved in a crackdown by the NHS on painkillers. Painkillers, they're paying 20 times the going rate for paracetamol. Painkillers, gluten-free food and other remedies. GPs will have to stop prescribing items that could be bought cheaply in supermarkets and chemists. Well, here, surely. The major cost-cutting plan, and the head of the NHS says patients will also be expected to pay for their own indigestion pills and hay fever remedies. Have I suddenly gone raving mad? On the rare occasions I have indigestion, fortunately I'm blessed with a fairly strong constitution, of those of you who know me, I wouldn't go to the doctor and say I need a pack of Rennies, and I'm sure other ones are available. When I go on sun cream, hello, hi, I'm on holiday, can I get the Amber Solaire, please? I need the prescription. What a pile of cobblers. No wonder the NHS is in so much trouble. There'll also be free travel vaccinations will come to an end. Well, that sounds probably about right as well, doesn't it? National guidance will say these should no longer be routinely prescribed on the NHS. There'll also be a big drive to recover the cost of treating European Union citizens. It is hoped that the savings to the health service could add up to 1 billion in 2 years. The money should be channeled to use for improvement for patient care and pay for life-saving drugs. Well, surely no one can give me an argument here, can they? Dr. Graham Jackson is co-chair of the NHS Clinical Commissioners, a GP, and leader of Aylesbury Vale CCG, Clinical Commissioning Group, joins me now. Your views on this, Doctor? Do you think it's the right medicine? Good morning.
Good morning, yes. Yes, I think the overall picture and direction of travel is right. What we need to do, of course, is make sure that the money that the NHS has is used most cost-effectively. I mean, you've touched on some of the issues there that are in the NHS plan that's coming out this week. But there are other areas to talk on. I mean, pick up one you mentioned there, the omega-3 fish oils. This is a product that is being prescribed that has no clinical value or very low clinical value and no evidence. And so what we're trying to do is trying to say there's a number of products that are being prescribed where the clinical evidence or the clinical value is so low that that is not a good, appropriate use of NHS funds. If we didn't spend the money there, we could spend it more appropriately on other conditions and other areas, cancer, mental health, primary care, wherever. I mean, we need to redirect the services we've got, the funds we've got. We need to make sure we spend that effectively and for the best outcomes for our population.
Doctor, how did we ever get in a situation where we were paying for these sort of items, such as gluten-free pasta and sun cream?
There are some historical conditions. So there are people who've got very, very severe skin conditions that need particular sun cream. Well, it's an extremely small area, but it's a small area that's allowed them to be prescribable, and then it's moved out. But there are other areas where that we need to think where there's drugs that are equally effective, but one drug costs 3 times as much than the other, and they're both prescribable, but actually making sure everyone prescribes the lower cost one saves millions across the country.
How do you suppose, broadly speaking, and I know it's very difficult, but how do you think patients will react to this news?
Well, I think the important thing is to take patients on the journey with us and explain to them that actually what we're trying to do is not do anything other than give them better quality care. If they're being prescribed a product that can be prescribed, then an alternative can be provided for them, which is just as good and appropriate for their clinical need, but saves the NHS money, then that money, it belongs to the population, it's taxpayers' money. We need to spend that on appropriate care for all.
Overall, then, lastly, you think it'll get a thumbs up?
I'm hopefully very strongly to hope it does across the country, and I think the number of people would line up and see this as a very sensible way forward and make sure we use the NHS pound most appropriately.
Dr. Graham Jackson, thank you. You co-chair the NHS Clinical Commissioners Group. You are a GP and you're leader of Aylesbury Vale Clinical Commissioning Group, CCG. Listening to that, another doctor, a brace of doctors, Dr. James Cave is a GP and editor of Drug and Therapeutics Bulletin. Do you think it's going to be easy to take patients on the voyage? Good morning, on the journey. Good morning.
Good morning.